Hi, I'm Neil Beck. I was a doctor in Perth, Western Australia for 53 years. I had 500,000 consultations, home and hospital visits, helped 800 babies into the world, and did many tonsillectomies and appendicectomies and all sorts of things that family doctors used to do and don't do anymore because we've got far more specialists. And what interested me most was what things gave people a good life and what things gave people a bad life, and who got the worst help when they were having a bad life. Of course, a doctor spends a lot of time with people who are having trouble. And I came to the very definite conclusion that the worst thing that could happen to you is to have serious mental health problems and not get the treatment that you needed, and in desperation to try to get help on the streets and become an addict, a heroin addict or an ice addict or a crystal meth addict or an alcoholic. I'd rather have cancer. So why did those things happen to people? Well, what I found was that there was never going to be enough mental health care workers for all the people who needed mental health care help. And a lot of people got no help, and as far as I could see, nobody got enough help. And the reasons for that, as far as I could see, was that the tools that mental health care workers used were, there were only two main tools, and they both had big weaknesses. One tool was medicines, and so many medicines were addictive. Worry, anxiety was the commonest mental health problem. The more severe forms, such as phobias, obsessive compulsive disorder, panic attacks, and all the medicines for worry, anxiety disorders were addictive. There was only one that I could find that was mildly addictive, and that was baclofen. I learned about baclofen when I read the book of a New York professor of cardiology, Dr. Olivier Amerson. He had severe anxiety disorders and became an alcoholic, and eventually had to stop practicing. And what saved him from his alcoholism was baclofen. What happened was that baclofen is a 1920s medicine for epilepsy, but they got better epilepsy medicines, and they stopped using that, but it was still the best muscle relaxant medicine. And people with paraplegia and quadriplegia often have muscle spasms, terrible muscle spasms. And about 30 years ago, I looked after 100 people in a nursing home called the Quadriplegic Centre in Perth, and we used a lot of baclofen for their muscle spasms. But I didn't know that baclofen was a tranquilizer, and I didn't know that it helped with addictions until I read this book, The End of My Addiction. What happened was that a woman doctor in New York had a paraplegic patient who was a cocaine addict, and he hadn't been able to stop cocaine, When he got muscle spasms, she gave him baclofen for his muscle spasms, and that enabled him to quit cocaine. And that got written up in the New York newspapers, and Professor Olivier Amerson, who at that time had to stop practicing as a cardiologist because of his alcoholism, he'd been to the 3 best rehabs. He'd tried all the possible treatments for alcoholism, and none of it worked. He always relapsed within a day or two. And when he read about this paraplegic getting off cocaine addiction with baclofen, he thought he had nothing to lose, so he tried it for his alcoholism, and it worked wonderfully for his alcoholism, and so he wrote the book, The End of My Addiction. So I then started to treat many of my heroin addicts with baclofen, and it was great for most of them, but it turned out to be slightly addictive. And I had one patient, 2 patients actually, but I can't remember one of them. My memory's not so good now, but one of them was an Asian lady who had been a heroin addict, who was a heroin addict, and she had 2 children, and her husband had just died from a heroin overdose, and she was in terrible trouble, and she had very bad anxiety, and I gave her baclofen, and it was wonderful for her. But she got up to 9 tablets a day, which worried her and worried me. And I overcome that problem by mixing baclofen 3 milligrams with 2 milligrams of the antidepressant mirtazapine and 3/4 of a milligram of microdose naltrexone. And that combination, which I call calm fast, worked very well for her. But I'm getting a bit lost here, aren't I? So the problem, the reason why there was always going to be a shortage of mental health care workers is they didn't have good tools. The medicine tool had 2 great weaknesses. One was that so many of the medicines were addictive. All the sleep medicines, all the anxiety worry medicines, and the 3 main medicines for ADD, ADHD, which are Ritalin, dexamphetamine and Adderall, all addictive. And the other problem with medicines was they're too slow. They work too slowly. Nearly all medicines come as tablets or capsules. If you swallow a medicine tablet or capsule, it takes half an hour to an hour to go right down your gut and start to be absorbed into your bloodstream and start to help. Half an hour to an hour to start to help, and 1 to 2 hours before it's helping strongly. Just too slow for many addiction cravings and for many mental health distresses. Too slow. The other main tool for mental health and addiction disorders is talk therapy, counseling, psychotherapy, CBT, call it what you like, but basically talk therapy. And the talk therapy had 2 big weaknesses. One is it's too slow. When I saw a new patient with an addiction, and they nearly always had 2 or 3 mental health disorders as well, it took me an hour to talk to them, to find out what their problems were, what's caused them to start, what made them worse, and what might fix them. And an hour is just too long. I didn't have an hour, and the other people helping addiction patients didn't have an hour. So talk therapy was too slow, and the other weakness of talk therapy was it was too costly, because to be a therapist you have to have at least a 4-year Bachelor of Psychology degree, or maybe a 6 or 7-year PhD in psychology, and to be a psychiatrist you have to have a 6-year general medical degree, and then a couple of years of general medical practice, and then 3, 4 or 5 years of postgraduate psychiatric training, so 10 to 12 years to become a psychiatrist. So people who are smart enough to do that training and to bear the cost of that training have to be well paid. They deserve to be well paid. If we don't pay them well enough, we'll have even less of them, because they'll probably do engineering or law or something else instead. So what I realized was that we needed more tools. Today, everything we do with tools. Tools enable us to do things much faster, much better, much cheaper than not having tools. When I was a boy a long time ago, we had tools, but they weren't that good. We had an axe, and we had a saw, and we had a hammer and a chisel and so on. But now there are tools for everything. When I was a boy in the kitchen, there were only 2 tools: a big tin dish to wash all your plates and knives and forks in, and a wood stove that you had to light every morning and keep on putting wood on to cook the food and boil the billy. But now there's lots of tools in the kitchen. There's electricity, there's gas, there's refrigerators, there's dishwashers, there's all sorts of things, and everywhere else there are tools, but not in mental health and addiction. So over 27 years I developed 8 tools, and because I wanted to talk about my 10th tool, I'll just skip through the 8th tool. But the 8 tools were videos, websites. My main website was mentalhealthvideos.a-to-z.com, but that was too long. People wanted the shorter one, so now I've got smilefixit.com. Smilefixit.com. My website's got everything on it, and you just tap the links to where you need more details. It's a one-page site. The third tool was an app. We developed the Mental Fix-It app, but I made that too long too. It was a 10-minute app that asked 38 questions about every aspect of mental health and addiction. But that was too long, so we reduced it to 19 questions, which you could do in 5 minutes, and once you'd done it a few times you could do it in 4 or 3 minutes, but even that's too long. So now we're working on making the Mental Fix-It app a 2-minute check, and then in 2 minutes you'll be able to check most things, and then you'll be progressively able to cover everything in 2 minutes, because some things that don't apply to you, we don't need to ask those questions again. The fourth tool was live streaming, which I'm doing now because lots of people like to watch live streaming. So I do live streaming 4 sessions a week, 7 p.m. Wednesday, Friday and Saturday Perth time, and 9 a.m. Sunday Perth time. But the 7 p.m. Perth time is 9 p.m. Sydney and Melbourne time, but sometimes half of our viewers are in the Northern Hemisphere, and 7 p.m. Perth time is 7 a.m. New York time and 4 a.m. LA time, which is not convenient. So I do the Sunday session in the morning in Perth, which is in the evening in the Northern Hemisphere. The 5th tool was powder medicine, because powder medicine works much quicker than swallowed medicine. If you drop powder medicine on your tongue and suck it, it starts to work in 5 minutes because it gets straight into the bloodstream very quickly. Your tongue is red because the blood vessels are so close to the surface. And you drop thousands of tiny grains of powder medicine on your tongue and suck it, and it gets in quite quickly and starts to work very quickly. And there are other advantages of powder. It's more flexible. You can get exactly the right amount. You can mix 2 or 3 powders together to deal with an addiction craving and 2 or 3 mental health disorders at the same time. But powder in a bottle with a little scoop wasn't very convenient, so then I developed my 6th tool, which is pocket powder medicine dispensers. You have it, your powder medicine in a pocket dispenser, and you just whiz it out of your pocket and drop it on your tongue. You can do that driving the car even, or anywhere, and so as soon as you feel a problem, you can drop the powder on your tongue and it starts to work in 5 minutes, and soon you get taste conditioning, and then it starts to work in seconds. The seventh tool was sorry, I'm just untangling this. The 7th tool is a heartbeat meditation aid. Meditation is so helpful for people with mental health problems and addiction problems, but the people it helps most often can't learn to do meditation with the usual focusing on your breathing or focus on the word. But if I cut a stethoscope short, that's the hearing part, and listening to your heart is very loud and attention grabbing and much easier way to learn to meditate. The 8th tool is a big powder pocket dispenser which dispenses tasty fruit powder, and people can use that to avoid smoking and to avoid sugar, cakes, biscuits, those sort of things if they've got diabetes. And also you can use lovely taste to make and break habits. And the 10th tool is what I want to talk to you about. I call it the Mental Fix-It Scroll Plus. The Mental Fix-It Scroll Plus. The app will be better when it's a 2-minute app, but a different way of finding what your problems are quickly is to be able to scroll. But there isn't anywhere that I could find where you could scroll all the mental health problems. So I found 81 factors in mental health and addiction. 81 factors in mental health and addiction, which are divided into 7 groups. There's feeling good makes you happy and healthy, 14 factors. Mental health disorders, 24 factors. Relationships, 8 factors. Family, 8 factors. Habits, 10 factors. Addictions, 11 factors. And medicines, 10 factors. So I'm working on this. It's not finished yet, but you'll be able to scroll quickly through all those factors, just a heading for each one. Let me tell you a few headings. Common mental health disorders cause, sorry, got that wrong. 11 common mental health disorders cause most of the bad feelings. We produce 25 feel-good chemicals in our brain, glands and gut. Our feel-good chemicals also boost our disease-fighting immune system, which keeps us healthy. So there's those headings for each of the 81 factors, which you can scroll through very quickly, and when you find something that applies to you, because a lot of things don't apply to you. Of the 81 mental health factors, you might only have 10. But when you come to one that you have, you can immediately tap on a short video, a 7 to 15 minute video, which describes briefly that particular factor. And if that brief description confirms that that's something that you need to know about, then you can tap a 1 minute video, which will give you quite a lot of detail about that particular factor. Let me read you the text, because I've made all the texts that I'm refining them, and we haven't actually filmed them yet, but we'll film them soon. So, to be both happy and healthy, keep your feel-good chemistry strong. That's the title. And if that title is something that you're interested in, then the 13-second video text is: what makes our feel-good chemistry strong are healthy, fresh, natural foods, drinking water, exercise, good sleep, sunlight, fresh air, smiling, dark chocolate, music, hugging, good sex, pets, and contact with nature. And if that 13-second video seems to answer the question for you, you can then tap on the 1 minute video, and the